Here at KTN News. Today we are shooting from the KTN studios at I&M Towers on Kenyatta Avenue. The Chinese have a proverb that ambition without knowledge is like a ship on land. Today Point Blank goes on a journey, on a healthy journey. What is healthcare in Kenya? How is it administered? Are Kenyans being taken for a ride? And before we discuss this in detail, we have to ask ourselves, is Kenya a healthy nation?
Doctors' strikes, nurses' strikes have been all too common over the past 3 decades. Sharing of beds, lack of medicine, and/or fake drugs in the market are all too common. Kenyans' experience of a flawed health sector ranges from bad to horrible. Can this change? And who is responsible for overseeing a total, radical, for the better alteration in the effort to achieve universal health coverage?
Good evening and welcome to Point Blank here at KTN News. This particular interview is dear to my heart because my guest, Joseph Aluoch, has been a brother, a mentor, but my doctor for more than quarter of a century. But before I talk to Joseph Aluoch, what has he done before?
Dr. Joseph Amolo Aluoch's journey to become the most respected chest specialist in Africa started over 5 decades ago when he joined the prestigious Makerere University in Uganda and graduated as one of the 11 Kenyan students in 1968. As a public servant, he was tasked with coordinating the National Tuberculosis Control Program Kenya between 1975 and 1980. In that period, Dr. Aluoch was appointed the Chief Research Officer, Director TB, Respiratory Diseases at KEMRI, as well as the Senior Consultant, Chest Diseases at the Kenyatta National Hospital and Infectious Diseases Hospital in Nairobi between 1976 and 1985. His feats were recognized by the World Health Organization, who made him their honorary consultant for tuberculosis between 1978 and 1986. Dr. Aluoch would also in that period not just develop the curriculum for training of clinical officers on TB and leprosy, but was tasked to head the training at the Medical Training Center, Nairobi. Dr. Aluoch has been appointed to serve in various boards, including the then Nairobi Area Health Authority, Hotel and Restaurants Authority, National Hospital Insurance Fund, and the KEMRI Board of Management. Between 1986 and 1990, Aluoch served as a commissioner at the now-defunct Nairobi City Council and was chairman of its Public Health Committee. The current president of the Pan-Africa Thoracic Society from February 2012 has written extensively with an autobiography titled In the Footsteps of My Father, printed in 2015, and over 70 publications, a majority focused on tuberculosis, generated over his illustrious career. Dr. Aluoch, who is a holder of the second-class Elder of the Order of the Burning Spear, awarded by President Mwai Kibaki in December 2008, is married to Justice Joyce Aluoch, a distinguished jurist who rose to become a judge at the International Criminal Court in The Hague. Together, they have raised 3 girls. From our team at KTN News, Tony Gashoka, and tonight's guest, Dr. Aluoch, we wish you, our esteemed viewers, a very happy and a remarkable 2020.
Good evening and welcome to Point Blank here at KTN News. Daktari, karibu sana.
Asante. Thank you very much, Tony.
My big brother,
Yes.
thank you for coming.
No politics.
Let me say from the onset, I've known you as the chairman of the Kenya KMA, vice chair of the Nairobi Hospital. I don't know how many.
I've been chairman or vice chairman of many organizations in my lifetime. Currently, I'm the president for the Pan-African Thoracic Society. I was in the city commissioner for some time. I was the chairman of the Public Health Committee in Nairobi City Council. And there are many other chairmen, and that will take the interview time.
And I also happy you have invited me as president of Nairobi Club.
Yes, I was the first post-independence president of Nairobi Club.
Now, Daktari, it's a pleasure to have you here, but I want to start by educating Kenyans from your many, many years of practice. First of all, what is health?
Very important. Health is a very precious commodity. For a long time, people used to consider health as opposite of disease. But in 1967, the World Health Organization changed the definition of health, not just a situation where there's absence of disease, but a standard of the highest standard attainable of living for a human being, not just merely the absence of disease, but social, economic, and human rights acceptably standard of living. So health is not just about disease, it's about social aspects of life. And it's also a human right. And lately, it has become a very important tool.
Daktari, in a broader sense, when you talk about health, you then talk about care. So how do you connect the health as a principle you expound on and the issue of care or lack of it?
Well, health care is when you take care of your citizenry, health. That means you cure the disease, you prevent the disease, and above all, you promote health. It's not just building hospitals and having medicines that constitutes good health care. No. In fact, that should be probably the last. The most important thing is to promote health. Make sure that the citizens are living in a healthy life. And in a political context, it means there is equity. That is, mean everyone has got access to the health care they may need, which means rehabilitation services, all types of treatment, and above all, promoting services and preventive vaccination. Okay. For a long time, we've just been talking, let us build a health center here that will improve healthcare, or let's build more hospitals. In fact, on a strict practical sense, hospitals should be the last issue you can think of building, building if you want to improve healthcare. In fact, the more people go to the hospital, the more your health system has failed, because you only get disease serious enough to go to the hospital if you have failed. For example, is in a developing world, nearly 40% of the diseases are due to environment. So healthcare goes beyond the hospital. It means you improve the socio-economic and the environment. If you see that 90% of our diarrheal diseases is due to the African eating their own feces. And that's what causes a lot of disease.
So Dr. let's expand on that a bit more.
Yeah.
So in our ordinary lifestyles, whether it is dirty water for cholera or lack of washing hands, so I wanted to talk you a bit more on the environmental contributors to poor health.
Yes, this is very important because, as I said before, in the 19th century, it was said that you could do without doctors and medicine, but if you improve the environment, you improve the healthcare by no more less than 40%. If you may remember, there was somebody called John Snow. He was a plumber in London. He's the one who eradicated cholera in London, not with medicine, but improving the water, the plumbing system and the water supply. Because the plumbing in London were leaking, so contamination was getting in the water system and giving people a lot of infection. So the most important thing is you take care of what you eat, because a lot of diseases in Africa, when it comes to just sanitation, is so-called fecal-oral route. The germs go into your stool, they contaminate what you eat, whether it's vegetables, and then you eat them. That's just one thing. But then it goes to other aspects of environment. That is the biological environment, the vector-borne diseases. There's still whether it's malaria, whether it is trypanosomes, there are many other diseases that are spread by insects. And that means you also improve the environment so that you reduce the vector-borne diseases, whether it's rats, many diseases done by rats, or even animals.
So, Dr. So that we move on, this environmental issue has two approaches I can hear. The human being controlling their own space and government policy in cleaning up. So you're calling upon both, the citizen and the government.
That's very true. The citizen controls his health, but the government assists him to control his health. Because the government cannot tell you, don't drink dirty water, but they should provide you with good, clean water. Now, you see, it's not just water, it's also the food, and above all, education. Because most people, awareness itself is a big tool in preventing infection. If you know that somebody has got infectious disease, you automatically be very cautious to get near him or touch him, isn't it? But if you don't know, you go to a nightclub, you start dancing, maybe the girl has TB, you don't mind her going to come close. But the moment you know, you don't even feel like sharing a room with her. So awareness itself, knowing what's happening and what may give you a problem, it may affect it, is very important. Health education.
Dr.
First, you say there are three things that are important in any healthcare. 1, education. 2, education. 3, education.
Dr. Joseph Aluoch, I want to talk to you about the principle of affordable and accessibility of healthcare. Affordability. What you talk about, the concept of affordable and accessible healthcare as a concept in our country.
You know, this concept was born not just in our country, but in the whole world, out of the necessity of having equitable distribution of health services. It was shown that 90% of the population in many places were not, particularly in the developing world, were not guaranteed access to acceptable, affordable healthcare without giving them any financial burden. This has been a problem, and most healthcare facilities have been concentrated in urban areas where there are only a small population. Now, in any population, you have got 3 groups of people. You've got the sick, and you've got the very poor and the unemployed. On the opposite side, you've got the people who are healthy, and they're not sick, they're employed, they've got the money, and they're young and active. Now, for the people who need health financing, and these people are poor, unemployed, and sick. Most of these people are healthy and not sick and working, having money, and the people afford or rather give health to these people. Now, poverty has been one of the biggest problems in the third world in promoting sickness. If you're poor, you're more likely to live in a dirty place and you get sick. And when you get sick, you can't go to work to get some money, so you'll be driven more into poverty. So it's a vicious circle. And as you get poor, you get sicker easily. And you get sick easily, you get poor. So it's a vicious circle. So you must break this circle, not just by healing the disease, but also reducing the poverty. Yeah. So long as the people are poor, some of these diseases cannot be.
So, Dr. I then hear about the issue of affordability in that context.
Yes.
Other than poverty, what does government do in terms of the community hospital, in terms of, before you come even to the referral, the access is there, assuming, and then affordability. I'm thinking about how decentralized is healthcare in your view?
No, by definition, anywhere in the world, health should be a devolved commodity. We have a problem in Kenya because we've not embraced devolution nicely, even in healthcare. And you find some doctors who are claiming that healthcare should not be devolved, they want to be central. But this is also because some of the their bosses in the divorces, in the maybe the what they call them, counties.
Yes.
Do not treat, says doctors. Well, some of them say, "Oh, you're not in our country, or we can't send you to training." They don't give them that democratic space they need. So they feel that no, devolution of the healthcare is not working. But it's a very good idea, and that's what's happening in most places in the world. It's a devolved system. Now,
from the community hospital,
from the community. The problem is we still have poor infrastructure. It's okay having we need human resources. Healthcare will first of all, you'll need preventive services, and that's most important in our cases. And this will have to go right down to the villages, make sure everybody can have access to vaccination. Childhood vaccination is very important, as you know. It prevents a lot of diseases.
So Dr. Sorry, let's go to preventive as opposed to curative.
Yeah.
Could you explain to viewers, because millions are watching you and may not actually know what is preventive as opposed to curative?
Yeah, there are several ways of preventive medicine, but the most important thing from medical point of view is give you vaccination so that even if you get that infection, you may not get sick enough. Your immunity is boosted or increased. That is through vaccination. And the best time to do is normally in the early childhood, before the age of 5, for most of the so-called vaccinable, immunizable diseases.
Like polio.
Like polio, like diphtheria, like measles.
Yes.
Yeah.
And Dr. even a mosquito net or a condom.
That's the next thing I was talking about vaccination.
Yes, Dr.
Then after that, then you go to improvement of sanitation, reducing the vector, whether in mosquito nets or removing the rats in the surrounding, or killing the rabid dogs, or improving water supply, food hygiene. Those are all preventive measures. Okay.
And Dr. if you look at Kenya on a scale of other countries developing as opposed to developed, to what extent is preventive care? Particularly, we've been hearing a lot about malaria and the fact that even quinine is failing, etc. Are we doing badly or well in preventive?
Well, to be honest, we're not doing well in preventive measures, let the truth be told. And if you can see how many cases of cholera we have is in Nairobi, reported every year. And that is a very sensitive index of poor sanitation. That means a lot of people living in Nairobi are still eating their feces. That's why they get cholera. And that's very poor. That means we are very far.
So it enters the food chain, the feces.
Yeah.
How are they eating their feces?
They eat their feces when the feces contaminate whether the water or the food or the vegetable they eat, full stop.
Or into the chain.
Yeah.
I see the food chain.
When you eat, whether it's fish or whether it's sukuma wiki or whether it's water you drink, so long it contains also Vibrio cholera, you are going to...
Dr. on the issue of vaccination, is it an option for parents or young mothers? Is there a role for the government to make it almost compulsory? What are the regimes in other...
It's very tricky and very sensitive. The government can only recommend and make it available that everybody be vaccinated. But at the end of the day, everybody has got a choice. One of your problems is freedom of choice, okay? Like you go to the hospital, there are some sects that do not want to be given blood transfusion, even if they need it. And there's nothing way you can force them before. Similarly, there are some people with their religious belief or some false belief, they don't like vaccination, some reason. There's no way why you should force them. But you can advise them that choices have got consequences.
So, Dr. therefore we come back to education.
Exactly.
And so what would you like to see more? Should this curriculum be taught through schools?
A lot of it.
What would you say?
There should be health education from day one, and not even in school, in print and public media. In most Europe, you go to America, every minute there's a health message on the TV or on the media somewhere. Or you can go to the monitors in public places, they have some health messages. It's so important that continue bombarding the public with health messages.
So Daktari, for example, when we were growing up, brush your teeth up and down, wash your hands, even that helps.
That's helped, but the education must be matched with availability of circumstances. I'll tell you an example, which I saw myself. In 1974, we had the first cholera outbreak in Kenya, and I was at that time part of the team. So we were in Kisumu, and that type, the WHO, which was helping us conduct the cholera eradication program, gave us leaflets to give to the wananchi. And it contained 3 messages. Please use the toilet, wash your hand with soap and water after toilet. Now, these natives, particularly in Ahero, they didn't have toilets. They were using the bush. They didn't have running water, and above all, they didn't have soap. So, see, that message was misdirected completely. So, even after we had built the toilet for them, some of the low people did not believe that your mother-in-law and your son should use the same toilet because there's something wrong. There's going to be a bit of a curse. So when you find that, you go behind the toilet, you find that native has, instead of going to the hole where the mother-in-law went, he has gone down behind there because they don't want to mix with the mother-in-law. So that's part of education and change attitude. The most important thing in this one is have the knowledge and attitude. You can have the knowledge, but never change the attitude. For example, everybody knows that you should use condom to prevent
STDs and HIV.
Yes. But how many people who know that, but still they don't use it? That's attitude. They believe that it's better off without it. Skin to skin. Yeah. So you have to agree. You have to
goes
agree.
Equal goes.
So you must agree that you have the knowledge. Make sure that knowledge changes the attitude. So you have to press it very much. Same thing in health. You have to educate them. That's why I said at the beginning, 3 important things in health prevention measures is education, education, and education. You can have clean water, you don't drink it, you don't use it.
Well, you're watching Point Blank here at KTN News. Dr. Joseph Aluoch, a physician and author of Footsteps of My Father, says education, 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 and it's about attitude. You're watching